Anterior instability or dislocation can lead to a tearing of the anterior labrum or soft tissue restraint in the front of the shoulder. Here the probe is showing a tear of the inferior glenohumeral ligament complex, otherwise known as the anterior soft tissue restraint, to the shoulder. This tissue is healed in a lowered position in this patient, which has led to increased feelings of subluxation. The first thing we need to do is release this ligament from where it is healed so that we can bring it back to where it's normally inserts. We do this with both a knife as well as a burr. You can see that the labrum is now more freely movable. Once this is done, we need to secure the labrum back down onto its normal position onto the bone. We do this through suture anchors. We first drill a hole, and then we place an anchor with some non-absorbable suture to be passed around the labrum. Here you can see the suture has been buried into the bone, and now we utilize a suture punch to actually pass the suture through the labral tissue. Once the suture is passed around the labral tissue, arthroscopic knots are then placed to secure the tissue back to its insertion. This is a fairly demanding procedure that was once done utilizing a formal open incision in the shoulder. Advances in arthroscopy have allowed this to be done through 3 small, tiny holes. Depending on the nature of the instability and the amount of avulsion of the ligament will determine how many anchors need to be placed. In this patient, a second anchor was placed, with again arthroscopic knots being used to secure the fixation back to the glenoid. Our final repair, which shows the labrum back where it's supposed to be, with no more instability on testing of the shoulder intraoperatively.